Hello toppers, today we are going to discuss regarding the peripheral signs of aortic regurgitation. Here mostly we will be seeing lot of peripheral pulsations and lot of pressure changes. Let's see. First sign, rapid and forceful distension of the arterial pulse with a quick collapse. You might be knowing regarding that, and the name is Corrigan's pulse or waterhammer pulse. And you can see this bird, and here the sign is bobbing of head with each heartbeat like a bird walking. You can see the image, and the sign name is ini-cet sign. Here you can see pulsation in the posterior part of the throat and uvula. As I had told, we can see lot of peripheral pulsations in aortic regurgitation. So what is the name of visible pulsations of uvula? It is called as Muller's sign. Here in this image, just have a close look over the nail of the thumb where we can see pulsation. So here capillary pulsation seen on light compression of the nail bed. Here even without compression we can see. Let's see the name of the sign. It is called as Quincke sign. Next, systolic and diastolic sounds heard over the femoral artery, which is called as pistol short femoral arteries, and the name is Trop sign. Don't confuse this with Trop space. Gradual pressure over the femoral artery leads to a systolic and diastolic bruit. So here the sign name is Duraceus sign. Popliteal systolic blood pressure exceeding the brachial systolic blood pressure by more than 60 mmHg. This is considered to be the most sensitive sign for aortic regurgitation. Try to remember this pressure changes because this might be asked in MCQ. And the sign name is Hill sign. If there is pulsation of cervix, what it can be called? It can be called as Shelly sign. Here, if there is hepatic pulsation, what it can be called? It is Rosenbach's sign. Here, if there is visible pulsation of the retinal arterioles, then it is called as Becker's sign. Here, pulsation of spleen in the presence of splenomegaly, what it can be called? It can be called as Gerhardt's sign, also known as Sailor's sign. A decrease in diastolic blood pressure of 15 mmHg when the arm is held above the head. This is one of the very non-specific sign for aortic regurgitation. Sensitive one is Hill sign. And this is seen in Maini sign. Systolic contraction and diastolic dilatation of the pupil. And the sign is Landolfi sign. So try to remember the name and pulsations and pressure changes in aortic regurgitation. This might be asked in MCQs. Happy learning with us. Thank you so much.